Awesome. So thank you to Bill Johnson for attending this event, Coffee with the Candidates. Also, thank you to everyone who is attending virtually and in person. We really appreciate you being here. And also to our ASL interpreters, Marcus and Mary. Thank you so much for all the work that you're doing. I'd also like to thank my supervisor, Nicole Rodriguez, and our CEO, Angelina Ramirez, for making this event possible. Also, Amanda Callenbach for handling a lot of the scheduling. And yeah, we really appreciate everyone being here. So my name is Brianna Zimmerman. I am the systems change advocate here at Stavros Center for Independent Living. So I mainly work on our legislative priorities. And so I will be your moderator today. We're going to be keeping track of time, noting when there's interpreter switches, and when we need to transition to the next question. And so some housekeeping rules for anyone attending in person. Just please keep a safe distance from other people. Wear a mask when you're not drinking coffee or eating. And also please respect our workspaces, of course. Note that your microphones, if you're attending virtually, should be muted upon entry, and you should keep your microphones muted unless you're instructed to do otherwise. We will be using the live closed caption function on Zoom and ASL interpreter services. For your convenience, we will be spotlighting interpreters and the speaker. Time permitting, we will provide the opportunity for questions and comments at the end of the discussion. Please keep all of your communications during these events cordial and appropriate, of course. And given time limitations, we might not be able to cover all of our questions. And so Stavros Center for Independent Living works to empower people with disabilities and provide the necessary tools and services to live independently. And so since 1974, we've been advocating for the civil rights of people with disabilities, regionally, statewide, and also nationally. And so by law, at least over half of our staff, 51%, have to have a disability. And so we really know about the experience through our own personal experiences having disabilities. And please also note that we are a nonpartisan organization that will not endorse particular candidates. Also, I'd like to thank Dignity Alliance Massachusetts. It's a grassroots advocacy organization that was formed during the onset of the pandemic in response to the high rates of death and infection in long-term care facilities. The alliance is made up of nursing home resident advocates, disability rights organizations, legal service entities, mental health organizations, health policy experts, faith-based groups, and labor organizations. And we really want to center the voices of older adults and individuals with disabilities. So some of our questions were derived from the folks at Dignity Alliance Massachusetts. And so with that, I'll have the candidate, Bill Johnson, introduce himself really quickly, just a minute or two.
Sure, I can handle that. Well, as Brianna said, my name is Bill Johnson. I grew up in Granby. I've been in business for over 40 years. I'm been married for 45, so I guess I'm showing my age here, but I have a lot of life experiences. I've dealt with my mother, who was in a wheelchair for 4 years prior to her death in 93 or 94. Time flies, but the ADA was voted in 1990. So unfortunately, she didn't really benefit a lot from the new law that went into effect in 1990. And also my wife and I were primary caregivers to my mother-in-law. And she was in a wheelchair for the last 4 years of her life. So I do understand. I don't want to make it sound like I fully understand, but I do have some experience and, life experience for the issues facing people with disabilities. And I think that the ADA, I mean, I believe that was the last big federal law that was passed. I mean, that was, 22 years ago. Anyway, so I'm running for Senate. My two sons are taking over the business. I have the time to be a full-time senator. I've been involved in public service since 1985. I started out on my conservation commission. I was a selectman in my town for 15 years. I'm currently on the Pathfinder School Committee. I'm currently a trustee to STCC. I'm president of the Statewide Towing Association. I'm president of the AICC Self-Insurance Workers' Comp Group. So I have a very varied background when it comes to a lot of issues, and I'm here because I want to learn. There's over 6,000 bills filed a year in the legislature, and there's no way any senator or state rep can be up on all of that. So the only thing that I look at, I appreciate groups like this, because if there's a bill that deals with what you do, I'm going to come to you guys for advice. So that's kind of where I'm at, and a brief introduction of myself, and I guess fire away with some questions.
Awesome. Well, thank you so much for the introduction, Bill. And I appreciate you also talking about your experiences being close to people who have disabilities. And we also appreciate you coming to us to ask questions. We always welcome that. And so with that, I'll start with my first question. And you've already discussed it a little bit, but I'll have you expand on it. So most Massachusetts residents know someone who has needed long-term care services or other types of disability services due to aging or disabilities, or experienced it themselves. Has anyone close to you needed nursing home care, congregate living arrangements, home and community-based services, like PCAs or personal care assistants, or other disability services? And what implications for public policy and regulatory enforcement do you draw from those experiences?
Oh, there's a lot packed in there in the question, but yes, as I mentioned earlier, my mom was in a wheelchair due to health issues. She had lupus. She had a lot of health issues. She had circulation problems. I was not the primary caregiver. My father was. But I do remember dealing with it. Like I said, the ADA was passed in 1990. So a lot of the public buildings hadn't even, the law really hadn't come to full effect. So it was very difficult to get her to things, so I drew that. So, I was a big supporter of the ADA in 1990. And so she passed away. My mother-in-law, my wife and I actually put an addition on her. We remortgaged our house, put a handicap addition on for my mother-in-law. So I dealt with, a handicap ramp, handicap bathroom, the sink, the door handles. I learned that, the handicap door handles, it wasn't a regular doorknob. So I learned things like that, which you don't think about, And with my mother-in-law being the primary caregiver with my wife, by 2000, time flies, 2006, when she was in a wheelchair, the accessibility issues were better. But my wife and I would bring her to the doctor's office so we could get in the doctor's office, but the care in the doctor's office, to me, wasn't up to where it should be. Like, she couldn't get on the examination table. The tables to me should lower. The simple thing is trying to weigh her. She had a real bad hip, so it would take like 3 or 4 of us to try to get her up on the scale, because she still could pivot a little bit. She wasn't totally, disabled. But so those type of difficulties, accessibility is one thing, but you need to be able to deliver on the services. And I think that's where we as a society are probably falling a little short, and we need more education and more work on that, from what I've seen. And my father, he was lucky enough to live to his 91, and he stayed in his house. But we dealt with a lot of PCAs with him. He was in hospice for his last, few months of his life. And that was, I shouldn't say, so I don't want to say it was a good experience, but it was a good experience dealing with the caring people, if that makes sense. The PCAs and the home health aides and everything. So I think that has really, we've made some strides there. But where I think, and correct me if I'm wrong, but where I think we need to, as a society, need to work harder is, we've worked hard to make accessibility, but now we got to work on delivering the services within those buildings. We got to, for example, bathroom stalls for the handicapped. You get two grown-ups in there in a wheelchair. They're not really that big, when you're trying to pivot around and stuff, So I know just with my father, bring him in with a walker, and you try, you got to fold the walker. It's just anyway. So I think that's where we need to focus. I don't have all the answers. I don't want to make it sound like I have all the answers, but I do have the empathy and the passion, I guess, to listen and learn.
Sure. Yeah. We definitely will get into more of a discussion around services and access, architectural access, and also other kinds of access. It looks like we are switching interpreters. Awesome. And so the second question centers around housing, which you already discussed a little bit in your own experiences. And so affordable housing is lacking across the state, and even more so for people with disabilities who need accessible housing and accommodations. And people with disabilities are actually more than twice as likely to experience homelessness than non-disabled people. And so what is your plan to increase the number of affordable and accessible housing units in Massachusetts?
That's a tough one. I think people have been trying to solve that for a while. The only way I can see it happening, I mean, from what I understand right now, just in general, there's a 17,000 unit shortage in the area, from what I understand. I think the way we need to deal with it is through private public partnerships, tax advantage, tax incentives for new construction, because to rehab a lot of these houses is just not feasible. I mean, that's actually when I talked about my mother-in-law lived in a house that was built in 1729 in Granby. Mm-hmm. So that's why we made a decision to put an addition on our house, which was up the street. It just wasn't feasible to try to rehab it with the door openings and the narrow hallways. And it would have had been totally gutted. It would have been it was cheaper to build new than it was to try to rehab it. So I think just tax incentives and private public partnerships, and make it an education. I don't think a lot of people understand what people go through. I really don't, and I think that's something that we need to try to work on. I don't have a magic wand with all the answers, but I'm here because I want to learn. I'm here because I care, and I think if somebody sits in the seat, says they know all how to solve all the problems, that's somebody doing a sales job, and I'm not here to sell. I'm here to learn, and I be an advocate for the disabled.
Awesome. And we do want to let you know about one of the bills that disability advocates have been pushing for is the Architectural Access Bill, which would make it so that the Massachusetts Architectural Access Board actually has authority over buildings that were built prior to 1991 and that have been converted into housing. It would also require employee-only areas and workplaces to be made accessible. And so that is a helpful bill to support. We also were wondering if you might support increasing affordable housing vouchers for people with disabilities, possibly funding more home modification projects, increase support for home care, and some similar initiatives like that. If you would consider supporting those sorts of things.
Well, again, there's a lot there, but I heard the constant theme was keeping people in their house. I think is that a correct? I think as a society, and I don't want to sound, number one, it's a win-win situation to keep people in their house. I think it's cheaper on a whole than trying to put somebody into a nursing home or whatever.
Sure.
And it's better for the person. It's for their mental health. It's better for the person.
Mm-hmm.
I mean, I get back to my mother-in-law. We had a hell of a time. My mother-in-law was like trapped in her bedroom and dining room. She couldn't even make it down to her kitchen because the way the house was built, it was, she needed help, but she just couldn't do it herself. Yeah, because it was like a two-step. But my wife and I had a heck of a time convincing her that this was the best move for her to come to our house. And once we finally convinced her, and then we built it, and then she was happy because she couldn't even take a damn shower or bath. She had one of those old tubs, that was, they're great. They're nice soaking tubs, but so we put in the full handicap, shower, and she loved it once she got in. But it was just convincing her. It was like we were pulling her out of the house. So I think we need to have also the counseling, I guess. I think you guys do that also on. I wish I knew about you guys back then. You could have helped us get her out of the house earlier, because it took us like 6 months to convince her to build the house, the addition, and that's 6 months longer. She could have enjoyed a better life, So the short answer is, like with anything, without reading the actual legislation and the bill, but I agree with the concept of keeping people in their house whenever feasible. Sometimes it's not feasible, but I mean, whenever it's feasible, I think it's the best thing to do.
Well, yeah, definitely the goal is to keep people living independently as possible in their own homes, and if not in their own homes, that they have rights in nursing homes and protections. And so my next question centers around transportation. Many people with disabilities and senior citizens rely on regional transportation to get to work, school, medical appointments, and also just to socialize and be active members of our communities. However, regional transportation is currently woefully underfunded and therefore cannot meet community needs, with many regions not providing late night or weekend services. This issue is compounded for paratransit riders as well, who face even more limited schedules. And so the RTA advancement bill would have made increased access to transportation by ensuring more funding for RTAs, dedicating half of Lyft and Uber's fees to funding RTAs, adding 2 seats for frequent riders to the RTA Council, and supporting electrification of RTA buses, among other things. And what is your plan for increasing regional transportation access in your district, particularly for people with disabilities? And might you consider supporting something like the RTA advancement bill?
It sounds it. I mean, if it comes out of the ride share programs, if I'm hearing what you're saying, is the proposal is take some of the money from the ride share program and put it into to help the disability. I have a towing company, and this happened many years ago. Is a person that was in a wheelchair got in an accident. It was like around 9 o'clock at night, and I asked the officer, "Gee, can you get transportation?" There was none to have. So luckily, I mean, this is what happened. I mean, the van wasn't runnable, but it still had electricity. So I had no help. The officers, they didn't send the ambulance, nobody. It was just kind of like, oh, well, you're kind of on your own. And, I got the guy back on his ramp, and I had to put him in his van and then actually load the van on my car carrier, brought him home, offloaded the van, and then got him out of his van so he could get back. He lived in Granby at Fence Hill at the time. And there was just no assistance. So that's terrible. So if there's any way we could expand on that, I'm all for it. It seems like, and again, correct me if I'm wrong, this is just my preconceived notion. It seems like once you become a senior, there's this council on agings with transportation. If you're 22 or below, still going to school, there's help. But it seems like if you're between that sweet spot of 23 to 60, it just seems like, well, yeah, you're on your own. And we need to fill that void. And I, like I said, I don't have the magical answers, but we need to look at how to fill that void. So I hope that answers your question.
Yeah, absolutely. I think a lot of people kind of fall through the cracks, so to speak.
Just from what I read from it seems like the 23 to, I don't know when the Council on Aging is 55 or 60, whatever.
Yeah.
It just seems like in between that grouping.
Totally. Yeah. There are also some pilot programs as well that actually use council on aging vans to help with transportation as well. So that could be an interesting.
Well, it should, because they're just sitting there at night. So that's where I would like to see. To me, being in business, my first inclination is not to throw money at something, because I'd be out of business, if that makes sense. So sometimes you got to look how you're delivering the services. Unfortunately, what I find with a lot of government entities, they want their own little kingdom, and they don't like sharing their assets, So, Council on Aging, the vans are sitting there at night, the weekends. Why can't they be utilized? Also even the school buses. I'm on the Pathfinder School Committee, and they have a school bus contract, and they have the handicapped buses and stuff. And maybe there's something that could be done there to utilize the bus instead of reinventing a wheel, reinventing another entity. Yeah. So anyway.
Awesome. And so our next question actually is kind of related to your work in schools and with kids and families. And so parents with disabilities too often lose custody or parenting time due to their disabilities. There's a bill, S1083, which would determine if a parent's disability causes actual harm to children using evidence. And it would also require evidence in writing if a parent's disability is a negative factor in custody or parenting time decisions. And also would assess whether harm could be avoided with some sort of adaptive equipment or support services for the parent. There are many children in foster care only because their parent has a disability and lacks access to equipment or services. There's also a lot of kids in the school system who don't get the disability services that they need. Would you consider supporting a bill like this that would create more regulations around foster care? And what else would you do in the legislature to ensure that parents and children with disabilities receive the support that they need?
Okay, again, pressing the question, it gets back to my other answer is, if I'm hearing it correctly, is so what happens is a child gets yanked from a parent that has a disability. So once they get yanked from that parent, now they go into foster care, and now they get the services through foster care. Correct. Yep. So why don't we just give the services to the parent to keep the child with the parent? It doesn't, again, it doesn't make any sense.
Yeah.
So, and not that I don't want to, I think most kids are better off with their parents. I mean, even if, everybody has a say, oh, I had a tough childhood or whatever. But I mean, I think overall, if you talk to anybody that grew up in foster care, I think they would have rather probably had a childhood that maybe wasn't I'm dating myself now. I'll Leave It to Beaver, who remembers the old TV show, Leave It to Beaver, this moment brought to you by, but I mean, so to me, it just makes more sense to keep the children with the parents.
Sure.
Whenever, and I'm sure there's circumstances where that cannot happen, but the first reaction should be keep the child with the parent, because once we pull them out, they're going to go into foster care, then they're going to get the services anyway. So why? It just doesn't make any sense.
Yeah. It actually does save the state money to pass a bill like this, because it allows kids to stay with their families.
Well, again, it's a win-win. It's to me, it's not always about saving money. It's about what's the best outcome for the child. I mean, yes, money's important. Yes, we need to look at the financial implications, but that's not always the answer.
Yeah.
You know, so it's like, it's a win-win situation, but in this particular case, it's a win-win situation to keep the child with the parents.
Totally. Great. Thanks for giving your complete answer on that. Next is a question about digital equity. And digital equity is the idea that everyone has the opportunity and capacity to participate fully in our society, including the economy, education, democracy, and also get access to vital services through the internet. People with mental, intellectual, and developmental disabilities, as well as older adults, report that their biggest barrier to accessing the internet is a lack of digital literacy, which means that they really need to learn how to use devices and the internet. People with physical disabilities report that their biggest barriers to accessing the internet are lack of equipment, so maybe lacking Wi-Fi boxes or lacking connectivity in their area. How would you suggest that the legislature address barriers to internet access for these groups?
I believe the Baker administration has done a fairly good job with this, and it is in motion. Because I know up to a couple of years ago, up in Franklin County, there was 35 communities that didn't even have internet. And I believe that's been tackled a little bit.
Yeah.
And what we should do is, I read a quote the other day that we as a society should guarantee the equality of opportunity. And with that being said, you cannot always guarantee the equity of the outcome, if that makes sense. But we should be guaranteeing the equality of opportunity. You know, like you talked about, some people, you know, cannot use the internet. I mean, maybe they just can't. I know I've tried learning some things with software programs, and I'm like a monkey clipping a keyboard, you know? So, I mean, I was given the opportunity, but the outcome wasn't good, you know? So we should try to foster, like I said, equality of opportunity wherever we can. The outcome may not be the same because somebody might not have the capacity to learn it. But I actually, I don't want to make it sound like, but there's a person we help, me and my wife helping Granby, a shut-in. She's got MS and she doesn't go out much. And, you know, we've helped her. We've offered to get her a computer, you know, to expand her horizons. But she says it makes her sick. I guess with MS, I guess she says that watching the screen, you know, makes her sick, which that was a learning experience for me. So, I mean, that's what I'm saying. So, I mean, we tried to create a, you know, equality of opportunity, but we couldn't guarantee the outcome because of what she didn't want it, you know? So I think you may have those type of cases sometimes, but all I can say is I get it. You know what I mean? If that makes sense, I get it. And we need to do what we can to level the playing field. I guess that's you know.
Yeah. And so there are some tools out there, and also the Affordable Connectivity Program by the federal government, which gives people who qualify based on their income, typically $30 off a month from their internet bill. And so we are interested in kind of expanding that, and also providing more accessible devices to people. My next question is around healthcare. And so having reliable and affordable access to healthcare is extremely important, especially for people with disabilities. Currently, many family members of people over age 55 on Mass Health are forced to pay back medical expenses to the state upon their family member's death. And so this essentially robs families of people with disabilities from inheriting any wealth. there is an estate recovery bill, which would protect the families of people with disabilities and senior citizens who are on Mass Health. And it would make it so that the state will only collect what is required federally, which is much lower than what Massachusetts collects right now. And this would eliminate estate recovery as well for those on the Common Health Program completely. Would you possibly consider supporting this bill? And what are your other plans to expand access to healthcare for people with disabilities?
You guys stay up all night thinking these questions or what?
Yes.
Healthcare, I think the one good thing that came out of the federal law and the Massachusetts law is the pre-existing healthcare. You know, prior, if you through no fault of your own lost your healthcare and you tried to get some more healthcare, you know, you couldn't get it. So I think that's one good thing. I don't think the insurance companies should disqualify you because of a pre-existing condition. I don't know if that was packed into that question or not, but so that's the kind of like the baseline. When it goes to the taking money after the Commonwealth already paid it back, I have problems with that, with that. It's like the inheritance tax, you know, it's because you think about it, you worked all your life, you earned your money, you paid taxes on it when you earned it, you paid property taxes on your house when you owned it, you know, so then now to take again, it's like how many bites of the apple does the government get, you know? So I would be hesitant to foster that type of you know, a scheme, I guess, by the government, and to try to keep it at the minimum. It's you know, everybody complains about the healthcare in this country, which there is issues. But the one thing I do say is when rich people get sick in other parts of the world, why do they come here? You know, think about it. You know, we have problems, but it's our healthcare system overall is fairly good, but we do need to work to make sure that it gets spread out fairly, and it's just not catering to rich people, if that makes sense, you know. So it's something that I think that's more of a federal issue that has to be dealt with on that level. I don't know in the state, other than looking at not taking money from the state, and but again, I'm here to learn. I mean, this is where I would probably say to you, I'm not going to sit here and say I have all the answers. You tell me what I mean, I'm not trying to sound, you know, you tell me what the answers are, and let's talk about it, you know, because we need to stop this this political discourse. How can we find solutions if people aren't willing to sit in a room and talk about things? So that's why I'm here. I mean, I want to learn. You know, I'm not saying I know all the answers at all, you know?
Yeah, that's great. Thank you.
Answers. No.
No. We appreciate, you know, you being here and willing to learn, and we're definitely, we want to foster these relationships and make sure that, yeah, our voices are being heard.
Well, that's one thing I can assure you. I'm transparent. You know, if I don't agree with something, I'll tell you, and then you guys tell me why I should be thinking otherwise. Because otherwise, if I just look at you and go, oh yeah, how are you going to get everything done? You know, so you got to have that back and forth. That's the only way you find solutions.
Absolutely. Yeah, that's definitely our goal, is to strive to foster these conversations. I think we might have time for maybe one more of my questions. Sure. I had a lot of questions.
I could stay longer. I don't know if you got. No, I'm sure. I mean, I don't know if you got another appointment.
We do have.
Can we ask questions? Can we ask questions?
I will give you the chance to ask a question right after this one. Is that okay, Joe?
Sure.
Okay. That's our buddy Joe, who is an amazing advocate. And so I'm sure he'll have a question. So one more question, and then we'll wrap things up. And so, as we saw in the case of the Holyoke Soldiers Home, negligence in maintaining public health and safety can result in serious illness and death, particularly for seniors and people with disabilities. And so there were over 80 residents of the Holyoke Soldiers Home who died from COVID. And many more residents and staff became seriously ill with the virus. So we've really, as advocates, have been pushing for changes to long-term care. And during the 2021 to 2022 session, the legislature actually authorized a bond for $200 million, which would undertake construction of small house home models for veterans in local communities throughout the Commonwealth. And this really is a sort of change from the very large facilities where residents often do not have a lot of rights or do not get a lot of attention, are often neglected or abused. And so what would you do to protect residents of long-term care facilities? Specifically, how would you advocate for more oversight of long-term care facilities and nursing home care, and also making sure that there's a workforce for example, home and community-based services like PCAs?
Well, the workforce is a difficult answer for everybody. I don't care whether it's myself trying to find a guy for my body shop, repair shop, towing, PCAs. I just talked to my CPA, my certified public. They're having a hard time finding help. So I mean, finding people to work is a challenge for everybody. The only thing you can do is to make sure they're getting paid properly and have benefits and rights. So in the workplace, that's not in itself is not going to solve it when there's not, that's like a furniture store saying, oh, we're having a sale on couches, but they don't have any couches to sell. So, you're going to offer as much money as you want per hour, but if the workforce isn't there, it's going to be difficult. And I think everybody's facing that right now as far as getting the proper staffing. As far as then the training, I do not know enough about it. If there's an easier way for a PCA to get certified. So that's one thing I would probably look at to see what the timeline is on that. And if there's any funding available to get people trained or they have to pay for another pocket. I don't know the answer on that. As to the Holyoke Soldiers Home, that was a terrible, terrible incident. And I think a lot of things are learned out of that. I had a fuel oil company, had HVAC. And for what I understand with the older homes, the group homes, like the Holyoke Soldiers Home, the floors were not separated by the ventilation. And that's one of the things we have to make sure for the new construction that those type of things are put in place so they can segregate the floor. So if there is an outbreak of whatever, I mean, it gets contained on that floor and you can react quickly and properly. And I think that was the problem, is just that the reaction time is very, I know there was a report that the state did. Some people say it's been discounted. Some people say it hasn't, but saying that the director didn't have the proper credentials. I can't really comment on that, but I mean, I think we need to make sure we have the right people running the place. I think building a new facility is the best thing to do. My wife used to work at the Belchtown State School, and as everybody's aware, or should be aware, there was a lot of abuses in the Belchtown State School in the 40s, 50s, and 60s. When my wife worked there in the late 70s, it was all evened out. It was what I'm getting at. Those abuses were stopped, and the people the residents that lived there, they had like a community. And then my wife went to go work in the group homes, and she said she hated it. The residents were treated like cattle, for lack of a better term. They didn't have a big yard. It was a little fenced in yard, posted stamps. There's no room for a garden because some like to do gardening. People like to have even if you're challenged, you like to have worth. You like to feel that you're contributing something to society or to your own well-being. And they weren't allowed in these group homes. They weren't allowed to do that. So when I hear group homes, I'm not saying I'm against it, but I want to know more about that type of, to me, it's like the old saying, you don't want to throw the baby out with the bathwater, so I think the group home can work if it's structured properly. I mean, not the group home, the like a soldier's home, a bigger facility. And maybe there is some of the veterans or people that can be put into a group home, but I think we need to look at that cautiously. I know my wife finally left the state because she didn't like what was happening in the group homes. She felt it was actually reverted back to more abuses. I hate to say it, because there was no oversight either, because now there's only 2 people on a shift. So when you have when you have 10 people on a shift in a big area, things will get caught. When there's only 2 people, the more can happen. But so I don't know if that really answers your question, but I think we need to look at the construction of facilities and make sure they're just ran properly.
Sure, definitely. And I'll be sending follow-up information to the candidates about some of the bills that Dignity Alliance Massachusetts has been supporting. And
I would appreciate that. Also, do you have like a narrative? Can you do a narrative on it, on the whys and whys not?
Yeah,
I would appreciate that.
Yeah, there are definitely we have fact sheets and things like that.
Yeah, I'd appreciate that.
And I can definitely send those over to you. There are specific bills and specific language and things like that, but the main goal is to increase oversight of nursing homes and long-term care facilities, and make sure that people are living as independently as possible where they want to be. So with that, I can ask Joe. I know Joe had a question. Maybe we can turn it over to the audience for questions.
Okay. I mean, I just had a few follow-up and comments. As far as the group homes go, the reason why the IL community prefers group homes instead of large institutions, it gets away from the idea of disabled ghettos where people are all stuck together. And I wanted to get back to the asset recovery program. The asset recovery program, the feds have approved an 1115 waiver, which allows people with disabilities on the common health side of the program to maintain their homes only if they've been paying into the system for 10 years and are over 65. That will be coming up because the 10-year piece of it doesn't work for people that were on 11.9, 11.18. It was another Social Security program. And as far as housing goes, one of the pieces that wasn't mentioned was that not only would the AAB bill allow for housing to be built more, have more buildings, but the 5% of the buildings of the units have to be accessible. 2% have to be accessible for people who are hard of hearing. But the beauty of it is the rest of the units have to be adaptable. So that means that opens up a lot of units that people who don't need a full-blown accessible unit. So if you're using a walker or something to that effect, you can still use that unit. So there's and to go back as far as housing, also is concerned, there's a home modification program that will allow up to $45,000 for people to rehab their home. So I think that as much support as you can give that program would be appreciated. I know that's a lot in a few minutes, but that's what I got, and I do remember Leave It to Beaver.
Well, on the reruns though, or the first show?
The first show.
Joe, I'm trying to thank you for your comments. I'm just trying to unpack. Is there a specific question, or you gave me a lot of valuable information there, but is there a particular question I can answer, or is it just?
Well, the asset recovery program will be coming to a vote, hopefully next session, and whether or not you would be in favor of maintaining, of voting in favor of having the state remove the idea of having Medicaid take the person's home away is important to us, and more importantly is the asset recovery program for people on common health. Now, common health is the same thing as Medicaid, except you're paying a premium. So I can't imagine any insurance company where you're paying a premium and they come and ask you to give you their home. So I think that's something to consider. So I would hope you would vote in favor of the asset recovery program.
In favor or against taking the asset?
Well, yeah.
Because it doesn't make any sense to me to take somebody's house, because now you're just creating, gets back to what we're talking about, where, what is, how can I say this? I mean, to me, a lot of these issues, when you look at them, is like, what makes more sense? I mean, whether if you feel as a society, oh, this person, let's say I get sick and you say, oh, Bill should pay. But what benefit is there of putting Bill out in the street? Is going to end up costing society more money. So it just doesn't make any sense. I think that's where you're going, Joe. I mean, yeah. And I think what I'm hearing from Brianna, correct me if I'm wrong, the state should follow the federal guidelines for that. That's what you guys are in favor for, following the federal guidelines. So I mean, I think if I'm understanding the whole issue, Joe, the short answer is no, we shouldn't be taking somebody's house. Because you're right, an insurance company is not going to take somebody's house if they pay out a big bill. It's just part of the rate structure.
Okay, that's great.
Does that answer your question, Joe?
Sure. Keep it in mind when it comes across.
Okay. Well, I gotta get by November 8th first.
Yeah. Well, that's true. It sounds like you got a big heart.
Thank you so much, Joe. And thank you for providing all of those nuances that I didn't necessarily have the time for. And does anyone else have a question? We might have time for one more.
We got time for two more, I think. I'm here.
No? I'll ask if nobody else. So I'm Dominic.
Hey, Dominic, how you doing?
Oh,
and I work with youth here at Stavros. So 1422. Over the three counties that we serve, and Granby is one of them. And
can you give me a second? Sorry, is the interpreter could hear?
Oh, can't hear me.
Yeah, no, she can't hear you here.
You can stay there.
Well, I can move over to the table too, so we can share.
Yeah. Everybody can hear you. Okay. Thank you. Can you hear me now? Okay. All right.
Awesome.
So again, so my name is Dominic. I work here at Stavros. I've been here for 4 years. And I work with youth. So they're 14 to 22 years old. And Granby is one of the towns that we serve. And when it comes to transportation, it's very difficult. So we were looking at because they want to get jobs, do internships, and we were trying to figure out how we can transport them there. And PVTA paratransit is one of the things that we looked at, but according to their website, so you have to be within 3/4 of a mile of a fixed route in order to get paratransit. So, you know, people that live in Granby and other rural communities are really out of luck when it comes to public transportation. So what I'm just asking is, would you support possibly expanding that to people that live in community towns like Granby and others where there isn't much public transportation?
Yeah. Well, Mike here. If you don't mind, I'll sit here next to you if you don't mind.
Okay, sure.
Dominic, that's a very good question. It gets back to, I think we kind of dovetailed on it a little bit with, I don't understand why, like, for example, in Granby has a very active council on aging and they have a handicapped bus. I don't understand why we can't use existing resources instead of creating new, you know, a new kingdom, new bureaucracy to deal with this. And, you know, that's why I said, it seems like, well, you said you deal with 14 to 22 year olds. What about the school public transportation? They don't help either. There's no help there either through like the regional schools or through the schools, because there's vans available there too. Well, I guess what I'm saying is I just don't understand. I'd be looking to do some sort of, even if it had to be legislation, to have these agencies work together. You know, it just doesn't make any sense to me that, you know, we have to create another agency to deal with this issue when we already have assets and you know, already involved, and we need to work together to solve these problems. Because I got a friend of mine, his son's got Down syndrome, and he was going to East Hampton for a program, and for whatever reason, I talked to John about 2 weeks ago, and the kid was devastated when he lost his job there. And I don't have all the facts, but I guess somebody complained that the people there weren't getting the minimum wage. But like what John said about his son, he didn't care about that. He just felt pride going there, you know. So now he doesn't have, you know, so now he's a shut-in because he's not going to this job at East Hampton that he had because of this whole minimum wage thing. And it's like, how does that work? You know what I mean? Is that right? I get people should get paid for what they're doing, but he was just felt happy to be feeling that he was contributing to society. Does that make sense? So I think there's a lot of things we need to look at and give and take, and I think we have the assets there, and it's just how to allocate them and get them used properly. I think that's the big problem. It's just nobody wants to share their toys. You know, it's like, oh, this is ours. You know, oh no, this is not yours. And I think we need to try to get over that somehow and work. That's where I would like to be the bridge to work on those things. I don't know if that answers your question or not, but
Dominic, I could give you a few answers. First of all, the half-mile limit that was set by the ADA, but there's paratransit, there's the ADA transportation, and there's also the local senior centers. There's a few ways you can scalp that cat. The problem is they all run on different schedules, and they're all in transportation silos, and we need people to put the money together and put it all into one transportation bucket.
Joe, right?
Yeah.
Yeah, and that's where I think, like if you get the COAs involved, so the Council on Aging could be that bus terminal, for lack of a better term, so then there's a place that's warm, it can wait for the bus, because it's not practical. You go to Granby or some of these small towns, it's not practical. It just really isn't to drive around. There's 28 miles of roadways in Granby, and it's like nobody would ever get to where they got to go if they had to make, multiple bus stops. So I think everybody can appreciate that, but just because of the difficulties involved in that doesn't mean, oh, too bad, you know what I mean? So sad. To me, let's try to find a solution to it. And, the Council on Aging, I think, would be a viable, solution. Anyway. Anything else from anybody? I'm here. Well, it's 5 o'clock. Brianna's going to shut us down.
It is 5 o'clock. And we do have Brendan Fair, who is going to be the candidate in the most western part of the state, coming in a minute or two, probably. So I just want to end with, we appreciate everyone who attended in person and virtually. We have a lot of people attending virtually, and folks will also watch the recording later. Would you like to make just a quick closing statement?
I appreciate the time. I really do. I went through you guys' service, I think 41 communities. You guys have grown quite a bit since 1974, since your inception, and 11 of that 41 communities will be in the Senate district, the Hampden, Hampshire, Worcester. The only community you don't have is Warren, which is in Worcester County. So I mean, 11 communities out of the 41, that'd be representing 25% of your, for lack of a better term, book of business, or the communities you service. So I mean, that I'm looking forward to working with you guys. I'm elected, and I'm fortunate to get elected. And see.
Well, thank you so much, Bill, for attending, and for everyone else who also attended. Thank you for your complete answers. And now it is time for Brendan Fair, who just arrived, to go next.